Welcome to Derm Power, where policy meets practice, hosted by the California Dermatology Advocacy Network. In each episode, we examine the legislative and regulatory forces shaping dermatologic care in California and what they mean for physicians and patients. Because protecting patient care means protecting the profession. Today's host is Dr. Ann Haas, CDAN President.
Hi, this is Dr. Ann Haas, and I am recording for Derm Power, which is the podcast for the California Dermatology Advocacy Network. And this is a breaking news podcast. We have tracked Dr. Miller down in Boston because we want to hear the latest on what he told us regarding the new SRT billing process. Dr. Miller, welcome back.
Thank you. Glad to be here.
Well, we're glad to have you. We would like to have you just rewind a little bit and just give us the bullet points about what had happened with the SRT codes, what the DermCAC had done, and then give us the breaking news.
Well, I think those who do SRT, that is what is now defined as surface radiation therapy, are most likely aware that 5 different Medicare administrative contractors, including Noridian, which is our Medicare administrative contractor, came out with a local coverage determination and a billing article that specify different requirements for providing SRT that will be reimbursable. And one of those requirements was discovered by those of us who peruse these things, and then specifically those of us who are on the DermCAC, that is Dermatology Contractor Advisory Committee, that there was a specific educational requirement that actually precluded dermatologists, or most dermatologists, from providing SRT. And what is that? Well, the LCD, the local coverage determination, and the billing and coding article specified the following: documentation of qualifications when requested of training and expertise that must have been acquired within the framework of an accredited residency and or fellowship program in the applicable specialty subspecialty. Period. This is the documentation requirement. Another, the LCD spelled it out as: a qualified physician for the service is one that has training and expertise that must have been acquired within the framework of an accredited residency and or fellowship program in the applicable specialty subspecialty, i.e. radiation oncology or dermatology. Period. That was it. Again, that rules out the vast majority of dermatologists who had been and are providing radiation superficial type of or surface radiation therapy to patients. Clearly an inequity that was spotted by DermCAC, and our DermCAC took action. This is action that involved communicating with the Medicare administrative contractors and with CMS to convince them that this was an onerous and completely unrealistic type of residency fellowship requirement. And specifically, it is patently clear that there are other procedures that are done in medicine that have expertise in which has been acquired through post-residency and or post-fellowship training. Well, a formal type of redetermination appeal was filed. However, that would have taken months and months to go through the system, rather than informing the Medicare contractors involved, led to an understanding by them that this was onerous and this was not reflective of reality in training. And pursuant to that and the devoted work and meeting with the MAC, or Medicare Administrative Contractors, and CMS, a revised definition of training was applied. And that says A qualified physician for this service is one that has training and expertise that must have been acquired within the framework of an accredited residency and/or fellowship program in the applicable specialty, subspecialty, i.e., radiation oncology or dermatology, or a dermatologist that has didactic and clinical experience in radiation treatment. And that is the phrase that is an editorial change. It did not have to go through a protracted appeal formal process. And this revised training requirement, which will allow the majority, if not all, dermatologists providing superficial radiation therapy to qualify for both billing and reimbursement for Medicare patients. A tremendous win.
It looks like a huge win. So essentially, the intervention of the DermCAC with both the MAC contractors and CMS sometimes doesn't budge. You folks basically educated them as to how it is that dermatology and other specialties as well, but certainly dermatology, can get further education that is not a fellowship in something like radiation oncology, but still we can get the training even after residency, which will allow us to be able to provide these services for our patients.
And not only that, but this change was retroactive to March 1st, which is when these requirements were published and enacted. That is both the local coverage determinations and the billing and coding article.
So it will allow those physicians, those dermatologists who do provide SRT services, the ability to back bill for the treatments that they have done basically at no charge.
Yes, exactly. And just keep in mind that the billing and coding article still requires that one attest to having received adequate training by adding on a modifier at the end of the billing. That is, you put in the code for the radiation therapy and then I think it's QZ modifier, but double check on that because I want to be absolutely certain of that kind of thing.
Would a dermatologist providing SRT services expect now to be reimbursed by everybody, assuming that the appropriate documentation, the appropriate modifier is placed? Would dermatologists who provide this service anticipate being paid by everybody?
Yes, I mean, dermatologists who provide the service and meet the qualification requirements should be paid as long as they also satisfy the long list of requirements within the local coverage determination, spelling out rationale for choosing out radiation therapy. And there are multiple bullet points there in the local coverage determination that require documentation within the patient's health record, meaning why do they qualify for radiation? And that's why it behooves every person who does surface radiation therapy in California to access the local coverage determination and the billing and coding article. That is easy to do through the Noridian website, and that is Noridian JE. If you want to just search it, it's Noridian Medicare, one word.com. And then you pick JE, which is our jurisdiction, pop up to the home site of Noridian and look for LCDs, local coverage determinations. They're also easy to find on the website, and you will find this particular document spelling out the multitude of documentation requirements that must be met. Now, it must be met doesn't mean that you have to send Medicare a list of, I did this, but rather it means that you should do it, you're expected to do it, and if your chart is audited for whatever reason, the auditor will be looking for every one of these points to have been documented.
So this would include private payers as well?
No, it does not. Private payers
Ah.
are not subject to local coverage determinations because that is purely a Part D Medicare document. That is, It pertains to patients who are enrollees of what's called traditional Medicare. That is the original Medicare, not HMO Medicare and not the PPO type Medicare that is also available.
So if it's a non-Medicare patient, check with the carrier first.
Absolutely, because there may be variabilities in coverage, but they will vary by the insurance company. And sometimes within a given insurance company, it would vary by the type of plan a person has from that insurance company.
Insurance has gotten much more difficult and has just created many more roadblocks for us trying to take really good care of our patients. It's really a shame. But you and the DermCAC, I think, have saved those dermatologists who do deliver superficial radiation therapy services. And the DermCAC, I think, is often an unsung part of our regulatory watchdog, and we really appreciate all of the effort and all the hard work that you have done on our behalf for this issue and other issues as well.
Thank you very much. I do want to point out that people on DermCAC are volunteers, and we spend our time for us and our specialty and our patients. And it doesn't matter whether we actually do those procedures that are specified within the coverage determinations. We work for all of our specialty, all of our dermatologists, and all of our patients.
And we appreciate that degree of advocacy. Thank you so much for the update, and that's a great tie.
Thank you.
DermPower is a production of the California Dermatology Advocacy Network. CDAN is a registered 501c6 organization representing the hardworking board-certified dermatologists in California. Thank you all for your amazing work. Please make sure to follow CDAN on all our social media, Instagram, Facebook, YouTube, and LinkedIn, so that you never miss an episode of DermPower. If today's episode sharpened your understanding of how policy impacts practice, then we invite you to join CDAN, especially if you are a board-certified or retired dermatologist. Learn more about our work at www.cadermadvocacy.org. Advocacy isn't optional, and CDAN is dedicated to protecting our patients in dermatologist-led care in California. See you next time.